As an orthodontist, I love the idea of Looksmaxing, but here's the deal. A lot of the advice that's being given online doesn't hold up scientifically or make sense biologically, and if you follow it, you could be doing real damage instead of actually improving anything, rather than getting guidance from people who actually understand how the face works and can help you do this the right way. I'm Dr. Eric Strouse, and in this video, I'm going to be breaking down the current Looksmaxing trends to tell you what works, what doesn't work, and share how orthodontics can elevate your looks to the max. Let me share an example of a real patient from my practice. I had a patient about 20 years old come in who was very focused on improving his appearance, and right away he told me he wanted a Marpy appliance. Now that's not something that patients usually walk in asking for, but it's becoming more common with everything that's happening online. So as we started talking, he was using a lot of very technical orthodontic terms. Counterclockwise rotation of the mandible, expansion versus retraction, asking if different things would cause his face to retract. Now a lot of the terms he was using are real terms, but the way he was using them didn't really make perfect sense or apply to his specific case. And it became very clear that he had gone down a rabbit hole online trying to figure out how to change his face without really understanding how any of it worked. Now the reality was this particular patient did not need a Marpy at all. There were no clinical indications for it, and this is something that I'm starting to see a lot more of. Patients asking for very specific treatments, not because they need them, but because they saw something about them online. And that's the pattern with all of this that I'm seeing. Mewing, bone smashing, excessive chewing, they take a small piece of truth and stretch it into something that doesn't hold up, doesn't make sense biologically, and can actually cause patients significant harm. So what I'll do is break down some of these trends one by one, and I'll start with the trend of mewing. Mewing is the idea that pressing your tongue against the roof of your mouth, you can actually reshape your jaw and improve your facial structure. The idea of mewing was popularized by John Mew. This guy actually had his dental license revoked, and his son, Dr. Michael Mew, who followed the trend, was later expelled from the British Orthodontic Society over concerns related to him doing harm to patients and promoting ideas that lacked scientific support. So this is not mainstream orthodontics. It's a very controversial theory. Online, mewing is presented as a way to sharpen your jawline, improve your facial symmetry, fix a recessed chin, and completely change your facial structure. And the obvious appeal is that it requires no treatment, no appliances, no money, no cost, just discipline at home. But here's the reality, and that's that there's no strong scientific evidence that mewing can significantly change the jaw structure, especially in adults. Organizations like the American Association of Orthodontists have looked into this significantly and addressed some of these concerns. Now, facial development is driven by things like genetics, growth patterns, skeletal relationships, and controlled forces made over time. This is not made by voluntary tongue pressure. Now, tongue posture does matter, and it matters a lot, especially in growing children, but that's a very different idea from that an adult being able to consciously reshape the face. And when people force these things, it can lead to muscle strain, TMJ issues, headaches, abnormal swallowing patterns. And the issue is that people delay getting proper evaluations because they think they're fixing their problem themselves at home. And the bottom line is that they're not remodeling their jaws with their tongue. The next one that I'll talk about is known as bone smashing. This is one of the most extreme trends that I've seen or heard about, and this is the idea that if you repeatedly hit parts of your face, your cheekbones or your jaw or your chin, you can force the bone to remodel and become more defined. People justify this by using concepts like Wolff's Law, saying that bone adapts to stress over time, and that's very sound scientifically. But it's actually a complete misunderstanding of how bone biology actually works. Bone does respond to forces, but controlled forces and physiological forces. That's how orthodontics works, and that's how surgery works. But making random trauma with blunt objects to your own face is not a controlled force. That's an injury. And the internet is taking a real concept, bone remodeling, and applying it in a completely irrational way. And it's done by using terms like Wolff's Law that are fancy and sound scientific, and in putting them into practice in ways that don't make sense. And here's what happens when people hit themselves in different areas of the face, creating trauma. It leads to unpredictable healing. It can lead to asymmetries. You can get irregularities in contours. It can lead to bone fractures and actually permanent damage. If making random traumas to the face actually worked, it would be something that oral surgeons and orthodontists would be using some controlled version of, but the fact is that they don't, because trauma is something that dental professionals treat, not something that we use to improve facial aesthetics. So bone smashing is not optimization, it's creating facial injury and can do significant harm. Another one that I see is excessive gum chewing. Gum chewing, especially things like mastic gum or other very hard chewing materials. The idea behind this is pretty simple, that if you chew more, you'll be able to build your jaw muscles and get a sharper jawline. And there's actually some truth to this. The masseter muscle, which is the main chewing muscle, can hypertrophy with increased use. Now clinically, I see this in patients who clench their teeth or grind their teeth a lot. They often have larger masseter muscles. So yes, some muscle growth can happen, but the idea behind this excessive chewing breaks down when it comes to the fact that the hypertrophy is limited and it's not controlled. In many cases, a larger masseter muscle also does not create a sharper jawline. It actually creates a wider and bulkier lower face. In fact, some patients, we actually reduce masseter size because it can negatively affect the facial aesthetics. Additionally, you're not actually isolating one muscle when you're doing excessive chewing, because chewing activates multiple muscles. There's the masseter, the temporalis, and the medial and lateral pterygoid muscles. So you're not actually sculpting an individual muscle in a controlled way, you're just increasing the overall load. And beyond that, excessive chewing can lead to TMJ issues, muscle fatigue, chronic pain, headaches, and even tooth wear or fractures over time. So even if there is some muscle growth, it comes with a cost that people don't actually understand. You're not sculpting your face in a controlled way, you're actually overloading the entire system. So if these things do not work, what actually does work? Now I'll talk a little bit from my perspective as an orthodontist and how the teeth can impact your facial appearance. One of the most important and most overlooked factors in facial aesthetics is your tooth position. Your teeth don't actually just sit in your mouth, they act as the framework to support your lips and your whole lower facial third. Particularly the incisors, your upper front teeth, can play a major role in how your lips and your profile look. When they're positioned correctly, they create a balanced support of the upper lip, a balanced relationship between the upper and the lower lips, and they help maintain a natural and aesthetic facial profile. Sometimes these teeth can be too far back, whether that's naturally or from over-retraction during orthodontics. When that happens, you lose that support, and what that looks like clinically is patients having thinner and flatter lips, less projection of the upper lip, and a profile that actually looks more retrusive or set back. So instead of the lips having a natural fullness, they'll sit further back and look less supported. In some patients, correcting tooth position can cause a noticeable improvement in lip support, to the point where they feel like their lips look fuller without actually adding anything to the lips themselves. And I've actually had adult patients feel like they've had Botox without actually having Botox or fillers. In some patients, correcting tooth position can give a noticeable improvement to lip support, to the point where they feel like their lips look fuller without actually adding anything to the lips themselves. Some patients has even told me that they feel like they've gotten filler to their lips, even though they haven't, because their tooth position gives that lip fullness from the support that they give the lips. And that's a type of significant, powerful change that orthodontics can make when it's done correctly. The next thing that I'll talk about is the smile arc. Smile arc is a major factor in how a smile looks. And to define that, it's the relationship between your upper front teeth and the lower lip when you smile. Now ideally, the edges of the upper front teeth are going to follow the curvature of your lower lip. That creates a smile that looks youthful, natural, and dynamic. That's in comparison to a flat smile arc. And a flat smile arc is actually very common. That's when the upper front teeth look completely straight across instead of following that natural curvature of the lower lip. This is actually something that a lot of orthodontists create. Some patients come in with a natural smile arc, and then after their teeth are straightened, orthodontists will flatten out the smile arc, and that leads to a smile that looks flat, less expressive, and less youthful, and over time it does not age well. It can make younger patients look older and adult patients look less vibrant. Now, to talk about how that's supported in research, this is actually studied in orthodontics very frequently. Research by clinicians like Tom Pitts and David Sarver, who are at the forefront of orthodontics, have shown that smiles where the teeth follow that lower lip line, what we call that consonant smile arc, meaning that the teeth are following that lower lip, they're consistently rated as more attractive than flat smile arcs. And this detail really matters when it comes, and that positioning of the upper front teeth compared to the lower lip, the smile arc, is really all in the details, because not all orthodontic treatments focus on smile arc. Some treatments only focus on getting the teeth straight. And there's a real difference between straight teeth and a well-designed smile that actually enhances your facial appearance. The next one that I'll go into is the arch width and buccal corridors. So another factor that impacts your appearance is how wide your smile is. If the upper jaw is narrow, you'll see what we call buccal corridors. That's just a technical term for the dark spaces at the corners of your mouth when you smile. So if you've ever seen a smile where you mostly see the front teeth and then darkness towards the corners, that's what we're talking about. And the reason this matters is because when those spaces are larger, it makes the smile look narrow, less full, and less balanced. It can give the appearance of the smile being constricted or the teeth being pulled inwards. Now, a broader smile fills in those spaces. It allows the teeth to show more when you smile, giving you that 10 to 12 tooth smile that looks fuller, wider, with a more aesthetic and confident look. Now, very similarly to the smile arc, research is done very frequently in orthodontics to show that broader smiles with minimal buccal corridors are generally rated more attractive than narrower smiles with large dark spaces. Again, this comes down to planning, and not all orthodontists focus on developing the arches, developing a smile width, and developing smile aesthetics in the same way, and that's where you see difference in the results. Now, your bite, believe it or not, plays a very large role in how your face looks, especially in that lower third of your face, basically from the nose downwards. Patients that have a deep overbite where the upper front teeth cover too much of the lower teeth has a clinical appearance of a very short lower facial third. It's what we call a reduced vertical space between the nose and the chin, and that gives a look where the lower part of the face appears almost compressed. So instead of the face looking balanced from top to bottom, that lower third looks reduced or compressed together. Now, orthodontically, we can correct a deep bite, and by doing that, we increase that vertical dimension. That can improve the facial balance, create better proportions, and make the face look overall more harmonized. Conversely, patients that have an open bite are in the opposite direction. That's when the upper front teeth don't touch compared to the lower front teeth when you bite down. Now, what this looks like clinically is a longer lower facial third. Patients often have difficulty keeping the lips together and a tendency for the mouth to stay open at rest. This is what we call lip incompetence, when your lips do not comfortably come together without effort. Now, correcting this can have significant benefits. It can lead to being able to close the lips at rest, reduce the strain in the facial muscles, and create a better overall facial harmony. And then there's the obvious, but still important part, and that's straight, healthy teeth. Studies have shown that people who have straight, well-aligned teeth are perceived as more attractive, healthier, more confident, and even more successful. So beyond structure, this has a real impact on how people see you. Now, orthodontics is very powerful, but it's not magic. It cannot change your genetics, and it can't replace surgery in certain cases. improving your appearance is often multidisciplinary. Different professionals handle different parts of the face. Beyond this, you also have to think about the basics: sleep, diet, hydration, proper breathing. These things all matter when it comes to improving your appearance. And also you have to think about individuality. There's not one ideal face. Everyone is different, and different things are going to make different people look better. Now, look, there's nothing wrong with wanting to improve your appearance. That's normal, it matters, and I fully support it and want people to do everything that they can to improve their appearance. People should take it seriously. But what I'm seeing right now is people taking advice from sources that aren't trained to actually understand how any of this works. And that is where things can go off track. So if you want to improve your appearance, that's great. What you want to do is make sure that you're getting guidance from people who are actually qualified to help you do it, because different parts of your appearance are handled by different professionals. And by trusting the professionals that have the education and qualifications to choose something that's individualized for you and to elevate your individual looks to the maximum potential is how you're going to make real improvements.